Hi, my name is Bailey Olson. I'm a nursing student at Viterbo University, and in this video I will be wrapping up my capstone experience in this TED Talk. So a little bit about my nursing background. Throughout school I've had my clinicals through my geriatric course, my Adult 1, Adult 2 course, my community health course, my psychiatric course, and then of course my capstone course. So for my capstone experience, I was located at Mayo Clinic in La Crosse, and I was working on 7th floor, which is a cardiac floor. This floor I was actually very familiar with. I was stationed there for my Adult 1 and Adult 2 clinicals, so I was very familiar with the staff, the kind of patients they were working with, and so on. I also worked at a cardiac unit last summer back home through an internship program. We were working on a cardiac unit, and I was very immersed in the same sense that I was in this capstone experience where the nurse kind of let me have free range after they get to know you and know what you're capable of doing, and once they have trust in you. So before my capstone experience, I really was able to dive into what a clinical nurse experience was like, and that was very exciting, and that gave me a lot of confidence too going into this capstone experience. So transitioning into this clinical synthesis, like I said, I already had this experience under my belt, but it was more of an exciting emotion that I'm finally at the stage of my schooling. My impressions going into this were pretty much what I expected them to be, the kind of patients I'd be working with, and my peers that I'd be working with. Like I said, I was at this site before for other clinicals, so I knew what kind of patients I'd be working with. It was still nice getting this practice of being part of the clinical team. I don't work outside of school. I don't work in any hospital, so any practice that I get before I actually start into nurses is great. Just getting that refreshment of what it's like, going into a patient's room, doing your assessment, working with other nurses, being part of the team. And that's also great practice for integrating the professional values that we hold true to ourselves and what we've learned in school, along with our evidence-based practices. So some of the values that I think is important in nursing especially is compassion. We talk about that in class and like nursing theory, but you really don't get a sense of that until you go into the hospital and work with these patients and understand what they're truly going through and how you make an impact on their life in a positive way. And then of course evidence-based practice. What I did my evidence-based poster on was heart failure and telemonitoring. So although I did not get to see the telemonitoring in the practice at Mayo, I was able to work with these heart failure patients and see the impact of how important education is to preventing readmissions in the hospital. If they don't get the required education or they're not retaining it, then there's a high likely chance that they're going to be brought back in with a heart failure exacerbations. Just seeing that evidence put into practice in real time physically is that was very important. I think it was good to see. So the goals that I set for my first journal entry, one of the major limitations that I set out to work on was my SBAR handoff. In school we talk about SBAR and we kind of do it at the end of a clinical round, but it's very different doing that, sitting down with everybody when everybody else is doing it, than actually giving handoff to the next nurse who's actually working with that patient when it matters, and being in the room with the patient. Especially, it can be a little nerve-wracking too when you're giving it to the oncoming nurse. They obviously know what they're doing, and when you're in front of the patient's family, because they want to be confident that you're giving that patient the best care, the best of your abilities. So I was able to, the first couple times that I did it, it was a little not the way I wanted it to go. I was not as fluid in giving the patient story as I was, say, the third and fourth, fifth, etc. times that I was doing it. I got it down. I actually got some compliments from a lot of the nurses, which meant a lot to me that I was able to work on that. So thoughts and emotions that I have from transitioning from a student nurse into my professional practice. Like I said before, it's just very exciting to come all this way, going through school. It's been a lot of hard work and dedication. To finally be at this point is something very special that all the experience that I've had at Viterbo I'm going to be able to put into my practice. And Everything that we learn in the classroom is really a core foundation, but it takes a lot once you actually get into practice, because it's kind of like you're really honing your skills on one specialization depending on what unit you're working in. So having all of that foundational knowledge is very, very helpful. But once you're getting in there, it's almost a different situation. But throughout all my years with Viterbo, we've kind of like built this sense of confidence in yourself that you can figure it out, what you're doing, and you have the ability to take care of your patients to the best of your ability. So wrapping that up, I think that my entire experience with this capstone has been very positive. I liked the experience that I had. It was familiar to me. It was good practice also for my upcoming job, which is also a cardiac floor. And overall, I had a great clinical experience for my capstone. Thank you.